Anything that you picked up? Safe areas of botox. Okay, good. What wrong with fillers and botox, particularly fillers? Fillers you can.
Fat is safer than.
Fat is in fact way better than fillers for a number of reasons. One is it is more economical. It's your own body fat, and it has a softer feel. Especially for the under eyes, fat is way better than fillers. There's no doubt about it.
Different indications, different locations of injections.
Of injection. So I'm in the next 5 minutes. I'm also going to talk about what filler exactly what filler you should be doing. Yes. Variety of fillers. So there are different brands. There's Juvederm and there's Galderma. These are the two major brands in India. And then within those brands, they have multiple fillers, which each has their own specific property. And then there are many other brands which have come into India as well. Don't start with the neck. No, so the thing is, don't start with difficult areas. Don't get adventurous. Remember, injectable treatment is a step ladder. You have to go stepwise. Don't jump into a lift. You will land up with problems.
Importance of anatomy, safe areas.
Safe areas.
And
complications and at least as much as we can tackle. Indications of fillers. Abhi, I'm going to expand on it.
Just the scope of fillers.
Scope of fillers, which is great because lift is one, and in fact you will realize that as you see patients in your practice, the temple region is one segment which adds a lot to the aging of the face. And the moment you start injecting fillers or fat into the temple region, it just changes the whole facial dynamics. Fat grafting, that is important. And at least for plastic surgeons, I think fat grafting is the first thing that we should think if a patient is okay with the anesthesia part of it. Sometimes we can't do it under local anesthesia, we need gentle. So if patient is okay with the swelling, with the small surgical part of it, absolutely. Fat grafting is something we should be doing, a lot. That is something which we have as a bonus over dermatologists. Yes, now I'm going to demonstrate that. So, come. So I'm going to now demonstrate how we select. Good, you're a good candidate, in fact. Sit, because I want people there also to see. Screen upar karna thoda sa. Perfect. See, I'm not seeing her face. I can't see her face at all. But what I'm going to show you is what you have to do with your patients to decide what is to be done. Now, on her face, she has a little bit of teardrop, very gentle. There's a proper V. I'll tell you what, and she has a slight laughter line. Now, suppose someone like her comes to you that I want to improve my teardrop, I want to improve my laughter lines. The first thought which will come to mind is, let's inject the laughter lines. Naturally, let's attack the problem. The second thought that will come is, okay, let's just inject a little bit of filler into the teardrop. Both are wrong. That is what should not be done. Now, what Dr. Sudhanshu was telling us about was the cheek points. Now, forgets 1, 2, 3, 4, 10, whatever the points. Use common sense. Why do these lines occur? That is because of the descent of fat as we age. She's a young girl, abhi tak nahi hai. This is naturally there. This is normal. Just to tell you, these are normal changes. Don't treat such changes. But if you see, just feel the most prominent part of the bone, wherever it is. Pull it up. Can you see any change? Remember, I am blind. I can't see anything. Can you see any change in her teardrop? You can. Any change in her laughter lines? You can. So laughter line, you can see a change, but can you see any change in teardrop? Probably not. So the treatment for laughter lines is inject here. So simple. Why do you have to go there? Just inject a little bit. Now, one word of caution for someone who's from an Oriental origin or males, be very careful in injecting here because people of Oriental origin, they have wider cheekbones. A lot of men don't like wider cheekbones. The moment you inject here, the face will get a little wide. So you have to be a little cautious. Now, if you have someone who has a wider face, how do we tackle that? We don't need to inject a lot. Someone who's thin-faced, what you can do is just inject, say, 0.3, 0.4 ml of a hard filler. Now, we spoke about soft fillers and hard fillers. So I'm not telling which brand it is. I'm not bothered about the brand. So Volux is there in Juvederm, and we have Lift in Restylane. A hard filler, inject it here. What will that do? That will create this effect. So we pull the skin and inject. So it will not allow the skin to go back. Got the point? It will, but remember, it's not that it will not allow, it will allow some of it to go back, but not as much. Now, we've done this. Next, see the next most prominent part of a bone, this. Now, when I do this, do you note any more changes on the face? But nasolabial to already done, hai na? Okay, now, yes. So when you do this, you might note a significant change in the teardrop. Remember, she has minimal changes anyway. So we can't appreciate, we will never get a complete resolution because she has very minimal lines. Got it? Someone who has deeper lines will note. So this point is more significant for teardrop. So I'm already holding my first. So we are assuming we have already done one injection here. Then we pull this up. Sorry. We pull this up and we can see some better change in the teardrop. So let's inject something there. 0.1, 0.2 ml of a hard filler there. If a patient is thin skinned, her skin is thin, Volux, a material like Volux might not work because it will stand out like a stone. It's a very hard filler. Then something little softer like Voluma might work better. So you don't want to feel stones on her face, right? Someone who's thicker skin will be able to take a harder filler better. So remember, keep that also in mind. So keep region wise also. Oriental people from the northeastern part of India have very thin skins. Keep that in mind. People from southern parts of India have thicker skins. So keep that factor. Otherwise, what will happen is patient will come back saying, what do I do with this? You'll have to dissolve the filler. Next is the most important point. So once this is done, on every face, my face, Akanksha, Sudhanshu, your face, look in the mirror and you will find that the teardrop and the lateral orbital line, they meet at one point, and that is it forms a V. That apex of the V is where you inject for the teardrop. That is what I have done all my life, and I have rarely needed to inject teardrop separately. Rarely. So if I look at her, this is one line, this is one line, this is the V. Clearly visible. Come. Who can't see you, come here. See this line, see this line, and see the junction. Got it? So we have pulled this, and then injected this, the teardrop will disappear. So this is all that is needed. I'm coming to that. Now I'm coming on to that. So you got the concept of the mid face. Now this entire area can be tackled in 1 ml of filler. Most people will tell you to do 3 to 4 ml. Not needed. Unless you want to really enhance the cheeks, you want to make Aishwarya Rai type cheeks or Sushmita Sen or Katrina Kaif type cheeks, that is a different thing. But if not, if you just want to make a pretty face, all you need is 1 or 1.2 ml. Not more than that, remember that. And for every patient who's listening to this, if your doctor suggests more than 2 ml of fillers for the mid part of the face, don't do it. It is being overdone. Remember that. Now, fillers are generally very simply classified into two: superficial fillers and deep fillers. Now, where all do we inject? Achha, last point before I get onto this. Suppose ye sab karne ke baad bhi there's a bit of laughter line left. What is the technique for that? So first injection, right at this point, go deep, hit the bone, hit the maxilla, and deposit 0.25 ml of a hard filler there. You can put Volux, whatever you want. Next, remember this. This is something which will save you a lot of money. It will save every patient a lot of money. It will save you guys a lot of money. For the rest of the laughter line, what is conventionally taught is inject either from up down or from down up, just below the dermis. Below the dermis is what is taught. What you should be doing, take a little bit of filler in an insulin syringe and go into the dermis and go horizontal. When you do this, some of the filler will get onto the cheek and it will actually enhance your lines at times, not always. So the simplest way, the most optimized way is take, for this entire line, you'll need 0.15 to 0.2 ml of filler. That's it. Go horizontal, multiple lines, and then just smoothen it out. Magical effect comes in. And you save. Same thing on the other side. And one more thing, remember, when you do the nose, you've done everything and still there is a tiny depression. Do the same thing there. Horizontal injection on that part, it lifts up the nose like that with minimal use. So please remember this one thing, that if you at all have to tackle after line, pull this up, pull this up, pull this up. If needed, put one deep injection and then go horizontal. Don't do vertical. It will save you a lot of filler, right? Now, under eye filler is something which many people are scared about. So I'll drive away that fear from you forever. Before that, let's talk about how to avoid. So how do we inject? We use this part. Remember, we always use this part. We never do this because it's a long muscle. FPL is a very heavy muscle. So we try to, how do you get used to doing that? When you give local anesthesia in your practice, inject with your hypothenar from today. For every hair transplant, for anything, start using your hypothenar area and you'll get used to it. And then gradually you will get used to even botox. When you inject, use the hypothenar. So this is a smaller muscle. So the movement arm is much smaller. You'll be able to stop your hand faster. You learn that, right? Second precaution, and again for all patients also, if your doctor is carrying the mobile into the treatment room, ask the doctor to keep the mobile away. Mobiles are the biggest problem when you're doing fillers, because when you're doing filler in this segment and the mobile rings, your attention just diverts. And that little turn of the needle can force some of the filler to get superficial. And that will cause swelling all over the face. It can cause Tyndall effect. It can cause a lot of edema, swelling, and migration of the fillers. So for that 10-15 minutes, just dump your phone. Third, one point that was raised was, is chin safer than the under eyes in terms of blindness for fillers? No. You can get equal incidence of blindness with a chin filler as you can get with an under eye filler. No controversy about that. It is simply because of the interconnections of the arteries. How do you avoid? The safest way to avoid initially in your practice, when you do fillers, get one of your assistant to press this. Source ko khatam kar diya. Now inject wherever you have to. So always press here. You will never get blindness. Second, never inject more than 0.1 ml in one shot. So it is said that even if 0.1 ml goes into the central retinal artery, it is unlikely to cause blindness because it is a very small amount. It is able to traverse and it's not just 0.1 ml, it is 0.1 ml done slowly, not like this. Very slow. Fillers just be so slow and you will not have problems. Vascular occlusions will not happen. That is the biggest problem with fillers. So with time, you will learn that, right? So this is a bone filler. Cheek to easy, hai na? I mean, chin is the easiest. Just hit the bone and tuck. Then what is the problem with the under eyes? That is also a bone. Just go hit, inject, come out. As simple as that. So why get scared of the under eyes? There's only one reason. There's orbicularis muscle. There's venous blood supply, arterial blood supply. You might hit one of the vessels and cause bruising. It's okay. If it happens, it's not your fault. 5 to 6 days, it gets normal. As long as you remember the other principles, you can't use a heavy filler here, correct? You have to use a softer filler, so in case you need some molding. So that is separate. You can't inject too much of it. Otherwise, the skin, you'll get Tyndall effects and spreading. So this is the same ease or difficulty as compared to this. Nose, remember, we'll of course show you later. Remember, there's a bone part, there's a cartilage part. When you start injecting from here, don't touch the bone. It's only the cartilage. And for the bone, you do direct injections on the top. Nose is very simple to do and very, very effective. So liquid rhinoplasty is one of the most effective of all filler treatments. So the cutaneous or the superficial injections for fillers are laughter lines, nose, any other? Temple, just below the dermis. So again, there are different approaches. Some people go deep. I prefer to just graze the dermis and inject. That is the safest. So just say above the superficial temporal fascia or just subdermal. So go slow, you'll not have problems. And you can. So I don't do it. It's an approach, but that is correct. And all other fillers on the face are deep fillers. Chin, cheeks, bone, nose, frontal region. Frontal, you have to be very careful. Don't go like this and inject horizontally. You'll hit some of the artery and something. This is the worst area. Also remember one more very serious, one of the most dangerous areas on the face. Any idea which is the most dangerous area on the face? No. 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 Yes. Close. So the horizontal or the vertical lines here, patients will tell you, please, can you eradicate these lines? Don't do it. This is the highest incidence of blindness ever. So if in case you have to do, safest is go horizontal and not like this. And horizontal is dermal. Simple. You will not get blindness. So this is the way to be safe, and safety will help you get better results in patients. So these last 5 minutes is something that is essential for everybody. Safest thing, always pinch here. Never do fillers without pinching. And wo instinct ban jayegi. As you keep doing, it will become very instinctive. And inject with your hypothesis. So that's my 2 bits about the safety and the types of fillers. So superficial fillers, you don't want very hard fillers. Obviously, when you're doing dermal, it has to be a very soft kind of a filler.